sure it's kicked off with a few questions that have come through from the kind of audience as well. And I know that you've been kind of answering those in some form or another. My questions are really going to be centered around looking at this from the three kind of phases in terms of the evolution of dengue. So the early febrile phase, in which we've all mentioned there, the viremia peaks in that particular phase, host inflammatory response is rising, capillary leaking is starting but not peaking. You've got probably a high concentration of circulating NS1 going down, thrombocytopenia starting throughout this early febrile phase. So my question to you all, in this early phase, what would be the most promising, from your opinion, drug targets or diagnostic targets? I'll start with Nilika, if that's okay. So what would be the most promising targets coming through, or areas, avenues? I know you've probably summarized it in some of the slides, but just for the benefit of the Q&A, what would be the most promising areas in the early febrile stage?
Yes, so actually, although the vascular leak is seen to occur between day 3 to 7, we see all these mediators that cause vascular leak, starting from host mediators like cytokines, inflammatory lipid mediators, the NS1 that Kevin showed, all of those, the highest levels are seen in the febrile phase. The NS1 is, of course, is a viral protein, but even the host cytokines or lipid mediators that result in vascular leak, like the ones I showed, PAF, and the enzymes that generate PAF, like cytoplasmic phospholipases, secretory phospholipases, IL-6, IL-1 beta, TNF-alpha, all of those are very much higher in the febrile phase than the critical phase, because we've done like twice daily sampling from the beginning of the illness as you proceed. So because of that, although it might make sense, okay, it would to think that only antiviral works during early illness, actually, because the mediators are, all these mediators are very much higher early in illness, I think the drugs that target vascular leak in the form of host proteins are ideally also given in early illness. So if I can elaborate on that, in the trials we did with rupatadine, and when we did a sub-analysis, when you gave rupatadine after day 4, which is when most people have sort of got vascular leak, it didn't do much. I mean, it did reduce, but it didn't prevent it. Whereas if you gave it very early, like within the first 3 days, it then prevented the proportion of people developing dengue hemorrhagic fever. So I think whatever intervention that it has to be done early. So in order to do an intervention early, public education is important to get down the patients early. Thank you.
Okay, thanks for that answer. Thank you very much. Are you aware, may I ask, are you aware of any kind of repurposing kind of programs, or kind of, looks into that, forays into that, using some of these PAF targets, these PLA2, the CPLA2 that you mentioned, these early markers in the early phase? Are you aware of any repurposing going on in that at the moment?
Yes, so we've been doing the rupatadine, and we've also been we had got ethics, and we were going to start montelukast, which is widely used in, again, respiratory allergies and chronic urticaria. And we were just about to start that trial when COVID happened. But I know in Singapore, people are using other types of things like ketotifen, which again is a master blocker mediated master stabilizer. So I know Ashley St. Jones was doing a trial there. Then people are also using things like metformin, which is anti-diabetic drug. Trials I think have started in Singapore. I know they were going to start. I don't know with the COVID whether that was on hold or not. So they were going to start metformin which is anti-diabetic drug. Again, I think when we look at dengue, the proportion of individuals, especially in Singapore, Sri Lanka, and certain countries, it is more, the morbidity and mortality are higher, becoming higher in adults, and especially in people with diabetes. So, and endothelial dysfunction, taking lessons from COVID, endothelial dysfunction appears to be a problem in COVID. It is much more a problem in dengue. So whether people, the risk factors of developing severe dengue, I mean diabetes and these metabolic factors have been shown in so many studies. So there are studies looking into repurposing anti-diabetic drugs as well. Thank you.
Fantastic. That's a great answer. Thank you very, very much for that, Nalika. I'll move to Kevin with the same answer in terms of this early phase. What would be your, I'm not really asking recommendations, but what would be the pointers? What's working, what's not working? What would you say is the most promising avenue in that early febrile phase?
Yeah, so I'm not a clinician, so I'm not going to probably step on Nilika's toes. She knows a lot more of what's being used in the clinic. I guess what's interesting to me in this parasite, in our study of parasites, is that other people, when they have looked in the clinic, some of these biomarkers that Nilika was talking about, we also see very early dysregulation of some markers that are known to be associated with this interaction between parasites and endothelial cells. For example, angiopoietin signaling is dysregulated in dengue, but actually in other viral diseases as well, where you see vascular leakage, for example, where viruses cross the blood-brain barrier or the placenta as well. So there is evidence that some of this signaling might be disrupted early and it might be useful, but we're currently trying to see whether there's actually other markers that we might not know about that might be specific to dengue. But I think when we think about the treatment, I suppose if we're looking, in my lab, we're very interested, obviously, in this leakage. And I guess one important point to think about when we think of treatments, if you sort of look holistically at the 3 talks you've seen today, is if we develop it, so if we were to develop drugs that block leakage, that actually doesn't stop people, getting very sick with dengue, albeit that they may not enter the critical phase. So I think, some of Priya Shah's work is very interesting because, of course, stopping symptoms, we often think about the critical phase in dengue and the leakage, but it's a pretty severe and horrible disease, even if you don't go into leakage. And ideally, actually, we would like to develop therapies against those, well, to stop symptoms to begin with.
That's a great answer, Kevin. Thank you very much for that. Do you anticipate because homing on the diagnostics of it, do you anticipate a new diagnostic coming out from your lab or from the work that you're involved in that would kind of bring all of this together? Kevin?
I mean, we're a very long way away from in my lab. I'm aware of other groups that are doing a lot of work in this area. I think where the field is at the moment is that it's difficult to find one single marker at the moment. There are various different markers that have been associated, but they're not necessarily associated enough to use in the clinic. And I know there's some interesting groups. Andrew Davidson, who's done at the University of Bristol, has done a lot of work in the Philippines and also with collaborators in Indonesia, actually looking at combining biomarkers, I think, and that might actually be quite fruitful. Because individual markers may not be as promising as maybe people had initially hoped.
Yeah, and I'm assuming, obviously I asked that question for a reason, that there's such a diverse range of attendees, not just now, but across the 3 days. You're open to collaboration at the Pirbright Institute. If people, that's kind of a rhetorical, well, that's a question to you, Kevin. If people want to get in touch with you about driving some of this forward with you, are you open to that? If, what's your outlook on that?
Yeah, so absolutely. I mean, I'm happy for people to contact me. And I would say, of course, we're doing this in collaboration with the University of Surrey, because the Pirbright Institute's really interested in zoonotic diseases and veterinary diseases and arboviruses, more in the context of the vector, which is actually mostly my work. So we're actually starting to move more towards some of these zoonotic hemorrhagic flaviviruses in my group, but we will continue our dengue work in collaboration with the University of Surrey in terms of the human disease.
Brilliant. Thank you very much for that, Kevin. Priya, I know that we left you to last because you were the last presenter there. I didn't want to overload you there at 2 a.m. You mentioned NS4A, NS4A and SEC61 in terms of this early phase, as far as I understood that, if I understood that properly. Are these that's your recommendation? Are there other areas around that? Or
No, I'm kind of the all of the above mentality when it comes to trying to find solutions, right? And so, I would love to explore additional host targets, right? We went after SEC61 because people have known for a long time using functional genomic screens back from RNAi in the aughts to CRISPR in the teens, that SEC61 is important for flavivirus replication and it's essential, right? So we had that piece of information. We didn't know what it was doing for the virus, right? And so this physical connection was really valuable in understanding that it was potentially an early feature, an early event in virus replication. And when you're thinking about antivirals targeting earlier events in the whole replication cycle, those 3 steps that have to happen, that's always going to be better in terms of dealing with the emergence of viral resistance and also just producing better outcomes for patients, right? And so like if you can find an entry inhibitor, right, that would be great. And we've seen that with HIV, right? And so I think having that sort of very early step in virus replication, the first thing that has to happen with a virus like dengue virus, a positive strand RNA virus, is that it has to get translated to produce that protein. And so if we hit it where it really hurts right there, it's not going to be able to do any of the subsequent steps. And so that's why that one is really attractive. The fact that it's not toxic, even though it's hitting an essential host pathway, is promising. And so the Taunton lab is doing work to look at clinical applications for other diseases as well. And so I think it is a promising avenue, but I'm also really interested in understanding, can we find modulators, not inhibitors, but something that can fine tune some of these pathways more specifically, like glycosylation, like mitochondrial activity, right? Because that could be really exciting. I think the other thing to remember is that, by the time someone shows up to the hospital with dengue fever, right? Like, is there really a clinical window for treatment for that patient? I'm not a clinician, so I don't know, right? But I guess one of the things that I also really like to think about in terms of timing and applications of these types of antivirals that focus on the viremia side of things, as opposed to the vascular leakage side of things, is that if you look at some of the very granular data on dengue transmission amongst household members, right? Like the transmission is happening within the household or with nearest neighbors because the mosquitoes don't go that far. And so one of the opportunities might be if you have an ambulatory dengue fever patient that gets sent back home, maybe the caregivers and the neighbors should be given one of these therapeutics prophylactically. Right. And so I think there's a huge opportunity there as well to benefit those communities in particular that are hard hit year after year by this disease.
Great answer. Thank you very much for that, Priya, and really showing how your work can impact these treatment strategies that need to be reevaluated. So that's a great answer. Thank you very much for that. Just coming to try to bring some of the questions that have been asked into this a little bit. I know you've answered this, Nilika, personally to the person. I think Dr. Khurram Wahid was asking a question around repurposing drugs like antiviral drugs if around IL-6. Would this be beneficial or not? I know you had that up on your slide earlier as well, Nilika. Would you care to kind of give us a kind of bit of your insights into that? Repurposing drugs on IL-6 would be beneficial or not?
So IL-6 levels are high in dengue, but we did a comparison study about the cytokine storms in COVID versus dengue. And actually in COVID, the IL-6 levels are like about 20 to 100 times higher than you would see in dengue. So we know that the recovery trial has shown that, for instance, IL-6 tocilizumab just work in patients with severe COVID, but the timing has to be right. And in dengue, IL-6 levels are high, but not at all to that level. And as Priya and Kevin just mentioned, it is not just one, but it's a lot of things coming together. And IL-6 is just one of them, because we know that just because you've got IL-10, you still have the other cytokines like TNF, alpha, and IL-1 beta. And apart from that, you have all the mast cell mediators and lipid mediators like PAF, leukotrienes, histamines, tryptases, chimases, which all of them do as well cause vascular leak. And apart from the host factors, you have the NS1 that leads to vascular leak. So just by blocking IL-6, I don't think, if it was the cytokine and you have very high levels as you see in COVID, then definitely, yes, I would say it's worth doing a trial. But when we did a comparison of COVID versus dengue, and IL-6 levels were nothing compared to in dengue compared to COVID. Thank you.
Great answer. Thank you very much. I know that you'd answered a question earlier as well. There was a question from Dr. Ida Safitiri-Laksono, complimenting the great presentations and also talking about the early phase. That's why I'm asking this question. She's talking about, where she mentions that in the real settings, many dengue patients presenting in the clinic may already be in the critical period as they present, i.e. day 4 to 5. And so did any of the drugs that you've seen or any of the kind of insights you got into those early, the stage, I suppose, the inhibiting viral replication as a potential area, the release of mediators within that. Do you think any of those will have potential benefits, given that the patient will be presenting, they're probably already entering the critical day 4 or 5 critical period post the early phase? Any insights into that? And I'll ask that to Nilika, sorry, and I'll widen it.
Yes. So if I can just talk about the Sri Lankan situation. I mean, in the beginning of the dengue epidemic in 1989, our dengue mortality was 9%, but now it has come down to 0.3%. In 2010, it was 1%, and what really made it come down from 1% to less than 0.3% was early healthcare. And that is in the absence of any of these drugs that it was reduced to less than 0.3%. And if you take a lot of other countries who are managing dengue well, the mortality rates are very low. That is because getting people down to hospital early. So whatever strategy is to detect the fluid leakage very early so that you give timely fluid management so that people don't go into severe critical fluid leakage, and then it goes, it's a vicious cycle, that leads to that, and then subsequently it goes on. So it's actually to prevent all of those happening. And so far we have been able to, even in Singapore, everywhere, the mortality rates less than 0.3%. The countries where you do see high mortality rates, for instance, there was a recent publication from India that the mortality rate is like 2.6% in some areas, and this is because of delayed presentation to hospital. So I think it is very important that the public health and the dengue control unit or whatever in that country has a strong public health communication strategy to make sure that the patients come into hospital early so that timely interventions can be done. And so in Sri Lanka, we have already sort of got that mindset in our population. So because of that, we do see for the drug trials we do, if you give it early, it makes a difference than giving it later. Thank you.
That's a great answer. Thank you very, very much for that. I could open that to Kevin and Priya. Any insights into that in terms of the lateness of patients coming in and the effects of any of this on that? Priya, would you?
Yeah, I mean, obviously, if you want to tackle that early phase of viremia, the earlier the better, right? And so encouraging patients to come in sooner rather than later, especially if you know that dengue is peaking in your geographic area, through public health messaging is going to be really, really helpful, right? And then in addition to that, I think, what we've seen with COVID-19 is that now there's an infrastructure in place for community surveillance, right? And so, taking advantage of some of that infrastructure after COVID subsides to redirect that to diseases that are more relevant for those communities will be really valuable and could potentially help indicate when patients need to be more vigilant and alert about these types of things. And so yeah, the earlier the better, especially if you actually want to help the patient showing up to the hospital as opposed to, preventing transmission to caretakers. And so those are the things that I would be thinking about.
Thank you for that, Priya. Kevin, any insight into that, or in terms of your the road to diagnostics? we're being asked questions in terms of,
yeah, I mean, I think Nilika and Priya really summarized it really well. I mean, what we're studying is probably too early to be useful in community diagnostics. It's maybe more useful when people come to the clinic. I think, Priya really hit it on the head as well. I think getting community diagnostics in place would be really beneficial, particularly in those really rural communities where actually they might not have immediate access to a hospital, but they might have access to a healthcare center, which will have different levels of resourcing. So, making sure that you can catch people early enough to send them to a place where they can actually get that really crucial clinical management. So I think any diagnostic test would need to really be able to be implemented in settings that are actually not necessarily in a hospital setting, but also in communities that are affected.
Great, thank you for that, Kevin. We've had a question coming from Dr. Aya Maya Win, who wants to know the role of platelet infusion in dengue. Is this an ideal biomarker, or is it really a lab marker for dengue severity? I guess that's the question. So the role of platelet, any insights into the role of platelet infusion within dengue? Is this an ideal biomarker or lab marker for dengue severity? I'll ask that to all three, whoever would like to answer that.
Yeah, so in the early years of dengue, because you have thrombocytopenia and some patients get very severe thrombocytopenia, platelet transfusions were given in Sri Lanka and many other countries. And so later, the usefulness of platelet transfusions were properly evaluated. And there was publication, it was published in Lancet also, that platelet transfusions actually don't have any effect at all, and they can actually cause more severe disease. So if I may explain it a little bit more, reduction in platelets or thrombocytopenia appears to be a result of severe dengue and not a cause. So, and that has been shown over and over again. So we have patients who have a platelet, now the normal count is more than 150,000, but patients with even 5,000, 10,000 counts, in the absence of leakage, they seem to be doing fine. Fine in the sense they have body aches and everything, but they don't develop severe disease. They have very low platelets. They don't have bleeding, nor do they have any other issues. So, most dengue-affected countries have actually studied this, and they don't recommend giving platelets. Even our national guidelines and many guidelines, including the WHO guidelines, do not recommend giving platelets because it's actually detrimental and doesn't serve the purpose. And whether platelets can be used as a good biomarker, I mean, platelets do reduction is seen, and if somebody is having dengue, is known to have dengue, or let's say the NS1 is positive. So if the platelet counts are coming crashing down, you would want to actually monitor that patient more carefully, because the platelet lowering of the platelets precedes the vascular leak or accompanies the vascular leak. But having said that, it is not a good biomarker itself of dengue hemorrhagic fever, because there are enough patients who have very low platelet counts, as I said, in the absence of vascular leak. Thank you.
Thank you for that answer, Nilika. I hope that's answered the question I'm sure it has. Any other insights into that from Kevin or Priya before we move to the next kind of question? No? Okay, great. So we heard earlier as well from quite a few of the earlier presentations, and indeed in this session here, the similarities between the patients presenting with COVID and some of the clinical presentation of someone with dengue. So I suppose I'm kind of asking the question, you need collaborations with the COVID world in terms of their understanding and your understanding within dengue? Is that starting to happen in your world out there or not? Or I'll ask Kevin that first. There has to be a case made to learn from the. Sorry, yeah.
Well, I don't know the case in other countries, but I mean, I think from the UK research perspective, we've got to remember that SARS-CoV-2 is an entirely new virus. So there wasn't really a COVID-19 world a year ago. So most of the people here who have been studying COVID-19 are actually people who had been studying dengue or Zika or other emerging viruses like Ebola, or there are some people who are already studying coronaviruses. And so a lot of virologists and clinicians have got involved here in the research. And because they're already part of these communities, there has, I think there's lots of opportunities for collaboration. I guess on a slightly different point, I think there are some, great opportunities for learning from both diseases. So actually one of the things that's interesting is, as I said, we've been looking at this parasite interaction to really understand, the molecular events in vascular leakage. But what's interesting is actually that COVID-19, of course, has a big cardiovascular implication. And actually it looks like, in fact, that SARS-2, the virus, actually does have some pretty major effects on parasites in the heart and also in other parts of the body. And we don't know whether that's driving the disease, but it's interesting that, the ACE2 receptor, which is the receptor for SARS-2, is actually probably most highly expressed on parasites actually within different cardiovascular cells. So it's an interesting link to dengue and actually to a lot of other diseases that have affected these interactions or known to affect the interactions, like HIV affects them as well, and Zika and Japanese encephalitis virus. So I think we're very interested in those commonalities between viruses, and actually maybe some of the lessons we learn with dengue might eventually be useful for treating COVID or other diseases that might emerge in the future.
That's a very interesting answer, this overexpression of ACE2 on that cell type. Very interesting indeed. Thank you for that, Kevin. Priya, you were nodding. Do you want have you anything to add to that? The COVID world and the dengue kind of world?
Yeah, so I mean, my group is not actively doing a lot of COVID work, but what I will say is that there are some really exciting opportunities now that that people are more focused on viruses and emerging viruses, right? And so one of the things that has come out of this is like the risk of another pandemic, right? And how do we get ahead of that, right? And so what I like to think about from that perspective is, can host targets actually serve as a way to strategically hit multiple viruses families, right? That are genetically unrelated to each other, right? And so by identifying these virus host protein interactions for multiple virus families, diverse virus families, right? We could potentially identify a core group of host proteins to really focus on, right? So that, there are some really exciting researchers that are pursuing how to predict the next pandemic using sort of these types of surveillance methods in zoonosis. But let's say we can't predict that. How can we actually best ensure that we're capable of dealing with whatever comes out, right? If we can predict it, great. But what if we're wrong? Do we have something in our arsenal that could also already work, right? And so I think that's where I'm very excited about all of the new interest in virology and the intersection with dengue and other viruses.
Yeah, that really alluding to the kind of not post-COVID, but the effect of COVID on our lives in terms of this renewed interest, this heightened interest. That's a fascinating kind of dot to resilience, building resilience, preparedness. That's a fantastic answer. Thank you very much for that. We do have a few more questions. Well, there are quite a few statements more than questions. So a lot of people are coming back with great presentations, really giving you a kudos in terms of the work that you're involved in. There's a question by Patricia Yulita Gunawan, who's saying, thank you for the great and interesting presentations. The question is, does isoprinosine, is it useful in dengue infection? Some of my colleagues usually use it in dengue. So I'm not sure if anyone wants to answer that or can answer that. It contains methoxyprenol. I'm not sure what or how to, if anybody wants, perhaps we can answer that separately. I'm not sure. There's a question by Belen Pedrick. Great session, thank you. Do we know why post-secondary infections are less severe than secondary infections? What could be the difference in the host response? So I suppose I could ask that to, I'll ask that to to Nilika to start with. Do we know why post-secondary infections are less severe than secondary infections? What could be the difference in the host response?
So actually, a secondary dengue infection is defined as an infection after the primary. So with the immunological response, the person has IgM and IgG. So you can't really tell if the person is getting it for the second time, third time, or fourth time based on just that. But given that, but if you think that the IgM and IgG refers to a second time infection, then studies following people up have shown that the person gets it the third time or a tertiary infection is actually less severe than a secondary infection. But having said that, in Sri Lanka, we have seen people who develop a secondary DHF go on to develop DHF again in a very severe manner. So this is why I think, given that DHF, the people who actually develop DHF are a minority, given the whole amount of people who are infected, and if a person gets DHF twice, see, I mean, that's a rarity. So I think there is predisposed host factors that make certain susceptible to DHF, which we're actually looking into. Thank you.
A lot for that answer. Kevin, would you have any input into that in terms of differences in host response? Why secondary infections are less severe than why post-secondary infections are less severe than secondary infections? What could be the difference in the host response?
Yeah, I mean, I think the dogma in the field, which may not necessarily obviously reflect most current thinking in the clinic, has always been that when you have a secondary infection, and it's I guess primarily secondary infection with a different serotype from the first infection. So obviously remember there are four dengue viruses, and there really are four separate different viruses that happen to cross-react antigenically. So when you have that secondary infection, you have antibodies from your first infection, and if you get an infection with a different serotype, those antibodies can bind to the virus, but they don't neutralize it. So they're not protective, but they do actually enhance entry of the virus into immune cells like macrophages and dendritic cells, which actually are where the virus replicates, and that causes a higher viremia and higher replication. And I guess the thinking, at least in the past, was that when you have a third infection or a fourth infection, that at that point you've sort of had a prime boost of infections, right? So your immune response is just much better able to deal with the disease. But as Nilika points out, you know, there is evidence now in various settings, including from Eva Harris's group in Nicaragua, that people can get infected with multiple serotypes, whether or not they present with clinical disease. So, you know, again and again and again. And as Nilika said, some of them are developing severe disease. So I don't know whether those people have a slightly different immune response, but it was always thought that the antibody response after 2 infections was protective, at least from severe disease, if not co-infection. But, you know, whether the thinking on that's changing, obviously, because that was those were quite early studies.
Thank you for that, Kevin, as well. Priya, would you have any insight into that, the differences in host response in terms of why post-secondary infections are less severe than secondary infections?
No, I think Nilika and Kevin really highlighted the salient points there. The only thing I will add is that, you know, the timing between these infections can be a significant factor in determining severity of disease, because antibody immunity can wane, right? And so that's also something to consider. Also, the field, the dogma in the field is very focused on the antibody response, but there's also a T-cell response, right? That we shouldn't forget about, right? And so it could be that some of these events are driven by T cells as opposed to an antibody response.
Great. Thank you very much for that. Hopefully, Belen, Dr. Pedrick, that's answered your question there. So thank you very much for the panelists for doing that. My final question, I've had a reminder that we're coming to the end of the session. I just wanted to ask actually a non-molecular biology-based question, really. Obviously, we are advocating, and we've been advocating for a World Dengue Day. We're at that point now. I just wanted to ask, really, from your work perspective, your professional perspective, how would a World Dengue Day help you in terms of, would this be useful to you? How would it be useful to you in a nutshell? I think you've got a couple of minutes. So I'll ask that to Kevin first, because he's on our dengue advisory group. So I'd ask you that. In terms of backing a World Dengue Day, if you had to say it in a nutshell, what would you say?
Yes, so I come at it from a research perspective, regardless of whether people are molecular or clinical or translational. And I think for me, one of the things is, people are doing really great work on dengue, but I think what we really need is for people from different parts of the world also to talk, obviously a bit maybe more to each other. And I hope that a World Dengue Day would be a really great forum to connect people from, all across dengue affected regions. And, we don't have dengue in the UK, but I think it will help raise awareness as well here of people who might be interested in contributing. But I think it's really about connecting people and having the reason for everyone to come together. And I think there's some really great regional events and really great to bring various countries together. But I think what we need is everyone to come together across the world. And, Nilika explained really well. And, there's this question of why dengue is more severe in Asia than in the Americas. And I think until you get people from the Americas really collaborating extensively with people from Asia, I don't think we're going to answer that question. And of course, there's this big black box of really what's going on in Africa, where we know there's a lot of dengue and it's not always reflected in the data that we see coming through in the reporting. So I think bringing everyone together to the table from all of the affected regions, I think is really important. And I think you need something like a global initiative like World Dengue Day to make that happen.
Fantastic answer, Kevin. Thank you for that. We've got the Ethiopian Centers for Drug, the CDC from Ethiopia on the next session in terms of their kind of take on it, and completely echo what you're saying in terms of the underreporting in areas like Africa. We need an event horizon, and we believe the World Dengue Day is that. Great answer. Nilika, could I ask you for your input into that in terms of a World Dengue Day, what it would mean to you? We've got in a few words on that.
Yeah, so dengue, the importance of dengue to countries like Sri Lanka is very obvious, and so South Asia, Southeast Asia, and the tropics, which are poorer countries, have been affected by dengue for years and years. And so a World Dengue Day would actually create awareness among other countries about the potential threat, and actually, okay, this is a big problem in these countries. And as Kevin said, it would be really great to collaborate. And actually, we just started to collaborate with Latin America Hepatitis group in doing a comparative epidemiological and immune correlate study between Asia and Latin America to answer that key question of why is it different between Latin America and Asia, or actually is it different when you use the same parameters? That is one important thing we need to find out. But also, like in countries like ours, the funding for dengue is sort of non-existent. So hopefully, with greater awareness, there will be more funding from the countries which do have funding funds to sort of funding dengue research in poorer countries. So that could be one way that this might help. Thank you.
Great answer. We really appreciate that. Funding is a bit of a sore subject here at the moment with the ODA cuts, but the G7 is on. Who knows? They might reverse it. But that's a great point that you've made there, Nilika. Priya, from your University of California, Davis perspective, would a World Dengue Day help?
Absolutely. There's no question about it. When I think about my own research, it has no relevance unless I can interact with clinicians and people who are developing drugs, right? So I think in terms of actually translating these sorts of molecular level insights into things that can improve people's lives, these types of events where you go all the way from geographic scale phenomenon all the way down into the molecular level detail is really valuable in terms of getting all these people together, right? And mixing these ideas. So from that perspective, these types of events are extremely valuable so that I can see the forest and not just the trees.
Yeah.
Right. I think the other thing from the US, we don't have locally transmitted dengue here right now. but we're going to, right? Like it's only a matter of time. And so right now, most Americans don't really understand why dengue is such a bad disease and why we should care about it. Fortunately, the NIH does, right? So it still tends to be pretty well funded, but it's going to become even more and more important for my country, right? And then just from a personal perspective, over half of my family still lives in India. And so for me, having these types of events that are focused especially on Southeast Asian and South Asian researchers and their work is really exciting to see.
Brilliant. What a great answer. And we really hope to be, the World Dengue Day will give that event horizon. It will be that galvanizing focal point to bring all the different disciplines together. On that note, I'd like to say a huge, huge thank you to all of you, to Priya, to Kevin, to Nilika for joining us from your various geographies at various times. And to have to sit through my not very good Q&A, but I appreciate that you took your time to do that. Some great answers, and I hope the audience have enjoyed that. Some really, hand clapping and great presentations. Thank you. A lot of people asking for your contacts. So you've kind of entered superstar status, I think, with the Southeast Asian research community, but you probably already have. But it's gone into orbit somewhat. I think they're all asking for your contact details. I'll leave that up to you. I'm being asked to come off at the moment because the next session has to be prepared for. So for me, thank you very much. For the ISNTD, thank you very much. And everybody who's joined us, the audience, will have a following session coming in the next half an hour. So for me, thank you. Enjoy the rest of your days and enjoy the rest of the 3 days that we've got planned. Thanks a lot. Okay, bye-bye.